Now, still staying with our bulletin, and in the county of Kiambu, we do have the concerns, and the aspect of the healthcare in the county. We've got some areas, like for instance, Ruiru constituency or sub-county is the most populous one, but only got a level 4 hospital a few months ago, I beg your pardon, which is over 60 years since the dispensary that was expanded was formed. Now, Martin Mora went and looked at some of the different facilities and what the concerns are around them. Take a look.
Step to medical attention. For some, it's an opportunity to visit their hospitalized loved ones. This wing stands in some contrast with the one adjacent to it, a new one, which was named Uhuru Kenyatta Wing. This upgrade and expansion of the hospital in Ruiru was unveiled in 2022 after improvements occasioned by the healthcare demands stemming from the COVID-19 pandemic. Its bed capacity rose from 46 to 200 with increased facilities including an intensive care unit and a theater.
Hospitali ya Ruiru ilipanuliwa, ni mzuri, iko na madaktari.
Tunaweza shukuru gavana yetu Nyoro kwa kututengenezea hospitali mpya hapa Ruiru, na tunaona service ya madoki huko tu iko sawa. Tunatitiwa vizuri, watoi pia, na madaktari tu ni wasafi, yani hospitali tu yenyewe ni safi, ni nzuri kabisa.
The Ruiru Level 4 Hospital was built in 1958 as a dispensary, which the management says attended to the Indians in the area. Since then, not much work had been done to improve the facility for more than 60 years, despite Ruiru being Kiambu County's sub-county with the highest population. A population that had been suffering the agony of taking their sick to hospital that are further away. The prefabricated structures behind me, which used to act as isolation center, came as a blessing to the residents of this popular sub-county of Ruiru, who used to seek services in the neighboring sub-counties.
Kama kuna hospitali tu nilienda, lakini sitasema jina. Nilienda, badala washughulikie watu, wanaanza kudance. So, mimi huwa kukunifurahisha. Nikaona nijaribu huku. Na juu na kusikianga watu wakisema Ruiru ni kuzuri. So nikakuja.
This has only increased what we have, and it has also increased the scope of work that we were providing before.
As they say, every rose has its thorn. Amid the praises, the residents also raised concerns.
Ile shida iko kwa hiyo hosi ni moja. Unaenda hosi unatibiwa lakini madawa hakuna.
Semeka ni maternity tu hivyo, bado wa improve ikuwe tu ni maternity kubwa, ikuwe hosi kubwa yani.
In another place in the county, the Githunguri Health Center has been a pain point for the residents, with concerns that it had been neglected and wanting on management. NTV has learned that the national government has taken it over in the president's now signature style of putting the military in facilities that he deems are not being managed well. Private individuals have even stepped in to salvage the situation.
And if you go to that small health center, people are so crowded. I have even given them a tent to sit on, because I went there, it's raining, people are waiting to be attended.
Challenges are everywhere. Of course, in all our 47 counties, our workforce has never been enough. So we are not unique to that.
The Tigoni Level 4 Hospital, which had been set aside for COVID patients, has reverted to being a general service hospital with the pandemic burden easing out. Martin Mora, NTV, Kiambu County.